Hey everyone, Miss Jessica here, and I'm just going to take you through some of the current approaches, sort of large categories of approaches that different organizations are using to sort of think about solutions, categorize solutions for some of these global health issues that we've been talking about. Historically, I'm not going to read this. I'm not going to read this loud to you. I'm going to sort of summarize it. You can read it on your own. Just like we had sort of a biological understanding of disease for a long time that didn't take into account a lot of the social factors, um, that was also sort of how solutions were approached. So the idea was once we figure something out that works, be it a preventive mechanism or a treatment for a disease, we just need to, kind of roll it out worldwide, wherever this happens, with no sort of context around it and understanding that that may be an issue. Obviously, just like we started to understand and talk about disease having social, economic, and political components, they started health practitioners, global health practitioners worldwide have started to understand that solutions also need to be take those social, economic, and political factors into account, and they can't kind of be one size fits all. They need to be appropriate for both the biological realities and the social, economic, and political realities that whatever outbreak is existing within. So keeping that in mind, there's sort of four main approaches that global health organizations now are using. And we're going to talk when we think about when we're reading and thinking about any solutions, we're going to see how they fit into these categories. They may fit into more than one category, but just keeping this framework in our mind. So here they are. So rolling out innovations and technologies, improving access to care, direct cash transfers, and large-scale behavioral change. So those are the things sort of the organizations are trying to do. And that is sort of the structure of the book that is for this course, which is linked here. Yeah, so please make sure you get that. But just to give you a summary. So the first one here is rolling out innovations. These can be medicines or technologies. So basically, this is about figuring out how to move something that works and taking it to scale. So it's like, okay, we figured out that if you take a 5-day course of antibiotics, it can treat this particular condition. And so it's about figuring out how then to take that and roll it out on a large scale. Again, these are ones that we've already figured out work, but we need to be effective. We need to figure out how to get people the actual medicines and technologies in people's hands, but also make sure they adhere to the treatment guidelines, which is always a big issue. So there's also often here a cost benefit question. So these interventions, a new technology may be quite costly. And so the question is this something that we want to sort of push out and invest our, not unlimited resources in limited resources. Okay, another thing that we may want to do is improving access. This usually has to do with reducing financial barriers. So the idea that having free or low cost healthcare available to large parts of the population, large percentages of the population. But that's not necessarily the only way that you can improve access. You can bring more physicians into a community. So there's also sort of a preventative primary sort of element to this. Like if you have more physicians in a community and people have more access to them, they will be going to the doctor more. But it could also be sort of more on the acute level. But just the idea is people have more access to care. Some questions that come up is an efficiency question around is going to the doctor more always better? meaning that could just mean that people are going to the doctor more because they want to go to the doctor more. It may not actually change health outcomes. Also, there's a quality issue. If you don't have the capacity to improve access to quality healthcare, then that may actually defeat the purpose. Okay, this next one's kind of an interesting one, and I think it's something that people sometimes get a little confused or uncomfortable about, but it's the idea of paying people to do what you want them to do. So that's sort of the general swath of it. So it's like giving, we want you to do a certain behavior. I want you to have your kid vaccinated. If you bring your child in for vaccination for all 3 rounds of whatever MMR vaccine that you're getting, whatever, we will give you the equivalent of $50 or $20 or whatever. So, so it's an interesting, and I think there's a lot of sort of ethical concerns people have with this, which I think is interesting to consider. I would encourage you to sort of maybe delve into this one a little bit, because I think it's definitely a way that a lot of international organizations are starting to think about how do we get behavior change to happen. But anyway, so direct cash transfers for doing something that we want you to do is another way that another type of solution. And then finally, there's other large-scale behavioral changes. Not like I want you to do this one thing, but I want you to do this thing consistently. So this is sort of around establishing healthy habits and preventing negative health incomes. There's a level of awareness here, but so it may just be something about making people aware of the dangers of smoking. But there also are more specific things that happen in order to induce behavioral change. Laws can go into place, and other sorts of techniques that you'll read about. These generally require like a pretty sustained attention. It's not just something that it's like you have one sort of campaign around this and then it's all solved. But yeah, so that's another one. That's another approach. Basically, just to be clear, these interventions can be mixed and matched. And some approaches don't just fit into one category. So when you're thinking about this, it doesn't have to be this or this. But generally, those are sort of the 4 ways that we're looking at how to solve global health problems. So here's an example. I'm going to let you go watch this video. It's a TED Talk by a doctor named Dr. Patel. He is a psychiatrist he's an Indian psychiatrist that's worked all over the world. And he kind of goes through some points here and talks about an intervention. I'm going to let you, again, pause. Okay, welcome back. So now, hopefully you've watched this video. Here's my sort of summary of what Dr. Patel talked about. He talks about this idea of task shifting and giving psychiatric medical training individuals in the community to give to be mental health practitioners and sort of be able to provide some of those services in areas that don't have great access to that. And you, again, hopefully you've watched that. So if we want to think about his approach, I would say that there's 2 places that his innovations fit 2 categories. Mostly it's improving access to care and making sure people that need care have it. It's a specific type of care. So it's having more mental health practitioners out in the community that will help improve access. There could also be an element of reducing social stigma. So because there's more people trained and more people talking about this, it may actually mean that more people are accessing or feel sort of emotionally ready to access this kind of care. The other part you could say, and you can see here, is it's also taking effective interventions to scale. So it's that first idea of rolling out medication or technologies. In this case, it's sort of a treatment that's proven to work. Having mental health treatment and access to that care has proven to work for individuals. So we're now taking it from just a small area study and taking it to scale into the community. Okay, that went way longer than I meant to. So the next step for you is to kind of go back through this, read through anything to make sure you understand, and then watch another TED Talk and try and characterize that approach. Thank you. Have a good day.